Special Day, and we've seen efforts by the government to ensure that drug abuse in the country comes to an end. To help us unpack this special and important topic, we do have Thomas Lindy and also we have Rachel Kitonyo. Thank you so much for making time for us. Rachel, let me welcome you to introduce yourself. Maybe I didn't capture your details well, please.
Hello viewers. My name is Rachel Kitonyo. I'm a lawyer by profession and I work with the McCabe Center for Law and Cancer.
All right, and Thomas Lindy is the coordinator at the Kenya Tobacco Control Alliance. Thank you so much for joining us. And this year's theme on People First, looking at the campaign that we've had previously. We had health experts saying that the government is doing it the wrong way. We do not threaten, we do not the people who are under the influence of drug abuse, because it's again a question of mental health. So let's begin with you, Tom, why this theme is important, that we need to sit back and think and put people first, stop the stigma and discrimination against people that are abusing substances in the country.
Thank you very much, Purity.
Yeah.
And, I think the theme that we have this year, it just speaks to the fact that those people who are using the drugs, they are our brothers, they are our sisters, uncles and aunties. So there is no need of shunning them or treating them harshly. We really need to care for this group of people. They should be given medical care like anyone else, so that they can move out of the use of drugs. So it's just a concern that we are not dealing with maybe zombies or people who are our enemies. No, these are people who need care and support from the whole society and also the country as a whole, so that they can be able to move out of the use of these drugs. So we should take care of them in any way that we can, so that we can free them from the use of the drugs.
And where do we draw the line, Rachel, taking care of them so that it doesn't look like we are encouraging drug and substance abuse? Because civil society organizations really do come out strongly in the country and ask the government to crack down on the illicit brewers, for example. And we've seen even the government vowing that they are cracking down and ensuring that these people are again arrested. So where do we draw the line that, yes, we need to crack down, but at the same time, this is how we need to take care of the people that are under the influence?
So I think you need to separate between the user who's using because of addiction, and that's a medical issue. So seeing them as patients, as Lindy has said, they are sick and they need treatment, and separating that from the people who are doing this to make profit, which is the trader. And unfortunately, it's always easier to arrest the user than it is to arrest the trader. And so the trader is doing it to make money and is making money out of misery of people. And so I believe the government should be firm with the traders. And we are talking about everything from the illicit brewer to the drug trafficker. And some of these are making really large amounts of money. And so those are the ones that we need law enforcement on. So let's stop arresting people who are drunk. Let's stop arresting the person found with one roll of bangi. Those are the easiest for the police to catch. Let's get the big fish. Leave the small fish. The small fish are sick people. They need treatment. The big fish are in it for profit. They need to be prosecuted.
And when she talks about the big fish, there was a time that Ketka, you're running a campaign and said that we have specific groups of people or companies that are really undermining the efforts, the fight against drug abuse. So who do you call the big fish in your perspective as an organization that is an anti-tobacco and drug abuse in the country? Who are the people or the bodies that are frustrating the efforts to curb drug use in the country?
Just like Rachel has mentioned, these are people who are in to make profit from the misery of the users. And we call them the industry. You have the alcohol industry, which is a big-time player in all this, and they are making a lot of huge profits from it. And also we have the tobacco industry and maybe other industries. For example, those who deal with the hard drugs, they are organized in such a way that it's difficult to penetrate them. So these are the culprits that the government should actually go hard on them and ensure that either these businesses they are doing is properly regulated, And if it's illegal drugs that they are working or maybe profiteering from, they should face the law.
Yeah.
And we have seen a lot of weakness in this, to a point that other international, I will say, other countries have come in to help Kenya. For example, the issue of the Akasha brothers. It was difficult for the country to deal with them, but it had to take the efforts of the American government to come in so that they could maybe take care of the situation. So, and I wouldn't say that once they did that, there are no other players. There are others who have moved to that level, and they are doing the same business. So, as we are looking at this menace, we should separate the two and make sure that the laws that we have actually protect the consumers, and also so that we have these people who can be get the treatment that they need to move out of these drugs. But the multinationals and the companies that profit from this business should actually toe the line and have a crack on.
Yeah. And Rachel, let's stay with the theme for this year, of course, putting people first and stopping stigma and discrimination. We'll talk about prevention later on, but let's talk about the kinds of stigma and discrimination that are meted against the people that abuse different drugs in the country, so that we see again some of these discriminatory remarks or even actions. Many people are not even aware of them. So let's talk about them.
I think it starts first with terminology. And many are guilty of that, including myself. And so, if, for example, you look at alcohol use in Kenya, majority of Kenyans don't drink. So our drinking prevalence is at about 23%, which means 80-something% are not drinking. So those that don't drink can be very judgmental on those that do. And then, so the terminology. And so when you hear words like drunkard, those are negative terminologies. Now, the medical term would be alcohol use disorder. And so starting with how we talk about them, and then even in a family, when you find that problem person, how we treat them, and sometimes you see their behavior, you don't see the person. So once you start appreciating that, one, it's an addiction. So sometimes people even say, why don't you just kick the habit? Why don't you control yourself? Use self-control.
Just stop.
Yeah, just stop. Yeah. I mean, what's your problem? But once you realize that it's addiction, really there's no more will involved here. The will has been taken over by a substance that's addictive. And all the substances we are talking about, tobacco is extremely addictive. It has got a quit rate of less than 30%. Alcohol is equally as addictive. And about 15% of people will have a really, really hard time quitting alcohol without any help. When you now move even now to the hard drugs, the narcotics and so on, it's even harder. And so it's no longer a question of self-will. So it starts with how we think about them, how we perceive them, not seeing them as persons, but seeing their behavior. So we accept some of the things that they do are not very nice.
Yeah.
But once you appreciate that the person who's doing it is not doing it because he wants, he's doing it because something else has taken over self-control. That's where it starts. Then the second becomes the services that we offer to them for rehabilitation.
Yeah.
And so if you look at Kenya, for example, we don't have enough rehabilitation facilities. NACADA has got a list on their website. A lot of them are private. And so even when you look at the cost, when you realize that something is a problem, then you must put money into dealing with it. And so far, we are not spending enough on providing treatment for such people. And so in able to restore their dignity, to be able to have affordable and accessible rehabilitation services. That's the second thing we need to address.
Yeah. All right. In case you have anything to add on the stigma and discrimination, but again, I'll also ask you to help us understand the difference between drug abuse and illicit trafficking, because that's what we are commemorating today. Yeah.
Drug abuse is basically the excess use of some of these drugs, especially, for example, alcohol. You have the tobacco and the rest, and we actually look at alcohol and tobacco in such a way, and also miraa, because they are some of the initial drugs, or we'll say that that's where someone starts from before he ends up in the narcos and the rest. Yeah. So when we don't curb the use of tobacco and alcohol, we are more likely to see people graduating to that level of using some of these other hard drugs. So we really need, as a country, to take care of this. And for example, the issue of alcohol. We have so many laws that have been put in place. Access to minors, the use of some of these drugs. But the sorry state is that even if you go to our high schools, we have, there's been a mentioning of alcohol and tobacco for a long time, and also cannabis or bang for a long time, which leads to some of the problems that we see in some of our schools. There's a lot of unrest. Sometimes a few years back, we saw students burning schools, each and left and right and center. Yeah. And this speaks to what we have come to as a country. So as a country, we really need to sit down, pause, and focus. What are we not having it doing right to address the issue of drugs in our country? Yeah. And once we have that conversation, we can be able to find maybe solutions. And we are happy for NACADA because they have come up with some initiatives. And one of the initiatives from their recent report is that they have seen that there is a lot of online sale of these drugs. There is a lot of online sale. You can just order alcohol online, the same with tobacco and the rest. Yeah. And Cat or Mira, or it's available in each and every corner of Nairobi. Where you look left or right, you'll find a cat being sold. So these are issues that we need to address, even to the underage or the minors. Yeah. There is no, we have not seen a lot of focus on this Mira, and you'll find that someone consuming Mira, you'll find him either smoking or using alcohol. They all do them together. Yeah. So we need to address wholesomely the whole of the issue of drug use and have a solution towards the same.
Yeah. And Rachel, last month we had World No Tobacco Day. This month we are having a World No Drug Day. This shows the seriousness or the impact that drug abuse is having in the globe, right? But nationally, we are yet to probably see, even last month, we didn't see serious campaigns, especially on the day against tobacco use. And today, I've not heard of a national celebration again on this day. Let's talk about the level of awareness and the seriousness that the country is taking the drug abuse in the country, because these national events are usually for making awareness on why we need to reduce use of drug abuse, but we rarely see national celebrations when it comes to drug abuse. Why is this so? Does this again impact negatively the fight against drug abuse?
So I think we are seeing a lack of political will, and some of it is because politicians are also involved. So particularly for hard drugs, I'll not mention names for fear of being sued, but we know that there are people who are very well connected who are behind the business. And so when I was talking about big fish, those don't get prosecuted. So you can talk about Akasha, but for Akasha to do what he was doing, there were local people who were covering up for him, all the way from the police, so that when they're supposed to be raiding him is informed, to even corruption in the judiciary, we saw that. So that's one thing. The politicians themselves are not serious. Now, even if you move to something like alcohol, we have our preferred, I guess you could call it culprits. And so in Kenya, we prefer to focus on illicit brews. So we like focusing on chang'aa and others. Now, in terms of the biggest drug abuse burden in Kenya, it's actually alcohol. It's alcohol, number one, then it's cigarettes, number two, then it is Mira, number three, and Bang, number four. So all these other hard drugs are a very small percentage. And so we like protecting these two big industries, tobacco and alcohol, and focusing on these others. So it's sexy to talk about Akasha. It's not sexy to talk about bottled alcohol. And so when we are busy focusing on slums and arresting that, we are forgetting mainstream alcohol. And so when we look at it from a policy perspective, he talked about availability. We don't have adequate laws on availability. So if you're going to protect young children, then you must restrict marketing. Right now in Nairobi, there are so many alcohol billboards. And so simple rules like saying that children should not be able to see this advertising. You put a billboard near a school, what are you trying to do? You put a shop selling alcohol near a school, what are you trying to do? And so it's nice and sexy to focus on illicit alcohol, chang'aa. What about mainstream alcohol? Now again, here I'm speaking to our deputy president. He's really passionate about this. I'm happy what you are doing with illicit alcohol. Can you also deal with regular alcohol? And so we're going to talk about a law on alcohol marketing. We still have advertising on television. We still have those billboards. We need to deal with that. Then when we talk about even awareness, when you look at the statistics from the NACADA report, 43% of Kenyans abstain. They don't use any of those substances. And their primary reason for abstaining is health reasons, which means that our most powerful argument right now is still to educate people about the health reasons. I would be really happy to see a law, and sorry, I'm speaking to you from a media house, mandating maybe 10 or 15% of coverage on health. And maybe for that you get a tax break. Because we need to be speaking to people. Now, he talked about online, but the adolescent health survey that's going to be published by the Ministry of Health for this year indicates that the vast majority of our youth are not actually on social media because they don't have a mobile phone and they can't afford airtime. The biggest way to reach them is the radio. If we could be talking on radio, it's not even TV, it's radio. And all the media houses have got a radio station. So you can imagine if we had a law, 15% of your programming must be talking. People listen to the radio because there's no household in Kenya that doesn't have a radio. There's no kiosk that doesn't have a radio playing. And we've got a lot of idle people just seated. They listen to the radio. And so it doesn't cost the government anything to pass a law like that. MPs are already paid. They are seated there. That's what they should be doing. It doesn't cost anything to limit marketing. And so even when we talk about, and then finally, of course, then maybe also raising the taxes, so that then with the tax revenue, you can fund those rehabilitation centers. And then the last thing is the licensing. And so again, one of the weaknesses of the Alcohol Control Act, when it devolved licensing to the counties, is that many counties now just saw it as a source of income. So then there's pressure to license more and more outlets. So when you look at outlet density and where they are located, you know, we actually have got more bars than we have churches and we have schools because it's a source of income. So the more licenses you issue, the more money you get. And so then we are putting profit before people. Coming back to our theme, that if counties were to put their people first, then you must reduce those alcohol licenses, and whatever money you get from licensing, you must put into rehabilitation.
Yeah, of course. And last month we saw you are driving a campaign on farming, tobacco farming, and you're trying to help farmers with alternatives on what they can do, because again, most of them were born in such places, making their money, quote unquote, because there's more loss to tobacco farming than the profit. Let's continue with what she's saying and highlight more on the most commonly abused substances. Is it in the country or in the region, whichever you like?
As she has mentioned, we have alcohol, which is at the top. It's maybe NACADA places as around 3 million Kenyans who are using alcohol, and that's a huge number. That means that effort should be put in place to help this group. And as we are saying, they are just our brothers, sisters, uncles, and that, to move out of that. And also we have the issue of tobacco. And as just you have mentioned, we had a theme last month that we need to grow food, not tobacco. And you see our country, we have an issue of food. We are not food secure. So all this agricultural land that has been put under tobacco, we can actually have more food stuff grown there. You can't eat tobacco if you are a tobacco grower, and they know that. So you have to get maybe some money to get food for your family. So as we are talking about this, it's a serious matter, and just as she has mentioned, our deputy president is doing good. That's the political side of it. But what are we doing with our maybe healthcare practitioners? Are we having rehabs for these people? We don't just have to do cracks after cracks so that we arrest some of these guys and the next day they are out of maybe a remand and they are still around doing whatever they are doing. What is the long-term plan for the country for these drugs that we are having? So the issue of tobacco, we are seeing maybe some light at the end of the tunnel. If we have all these people who are doing tobacco agriculture move to food crops, we'll have less cases of diseases. You know about the green leaf tobacco disease that is affecting the tobacco farmers and the families, the issue of child labor and such. Some of these things we can easily take care of them if we actually develop some of these initiatives.
Right.
And that one moves out as even closer to other drugs, for example, Mira and the rest. We should also have initiatives that will help the Mira farmers have other alternatives to that, so that they can also help their families. You can't feed on Mira, you can't feed your children, though we know that there is a lot of money in Mira, but we also need to help these people also move to something else if there is an alternative that will help their families.
Okay, we now want to take a short break. Today is World Day Against Drug Abuse and Illicit Trafficking. In studio we do have Thomas Lindy from Ketka, and we also have Rachel Kitonyo. They're helping us unpack this. When we return from this short commercial break, we talk about the health impact of this and also